since the beginning of COVID-19, we've had over 100,000 blood drives to cancel simply because most of our blood drives are hosted by high schools, colleges, churches, and community organizations. So when many of those organizations and businesses closed during quarantine time, that meant that we lost a huge number of blood drives. And so in response to that, we had to think very quickly because, of course, the need for blood doesn't stop. And we had to make sure that our hospital professionals didn't have another health crisis on top of COVID-19, which would be not having enough blood on hand to be able to meet the need for patients. So we began to host drives at many of our Red Cross chapter offices, and we did have a number of organizations that did, hear the need and step up and aid in hosting drives as well.
So, there's so little, or we're learning so much as we go about COVID-19. Is it safe to give blood in the time of COVID-19?
It's definitely safe to give blood, and the American Red Cross is doing all that we can to ensure the safety of not only our donors, but our staff as well. And so each blood drive and donation center follows the highest standards of safety and infection control. And we make sure that we're checking temperatures of our staff and our donors before entering a drive, just to make sure that they're healthy. Providing hand sanitizer for use before and during the blood drive and throughout the process. We're also following our social distancing protocols for the safety of our donors and our staff. We're routinely disinfecting all surfaces, the donor beds, and all donor touched areas. And we're making sure that our team are wearing gloves and changing those gloves often. And of course, we're using sterile collection sets and aseptic scrubs for every donation.
But what's important for people to know is that you cannot get COVID-19 through blood.
That is correct. COVID-19 cannot be transfused or transmitted through blood donation. Neither can any virus be transmitted through the blood donation. And so that's what studies have shown us, and that's what the research is showing.
Okay, so now as an added incentive, as the world and the nation, especially our nation, begins to reopen, the American Red Cross is offering for a limited time antibody screening. So if you're a blood donor, you give blood, you can also be screened to see if indeed your blood contains the antibody for COVID-19.
That's correct. The antibody test is authorized by the FDA, and it may indicate if the donor's immune system has produced any antibodies to the coronavirus, regardless of whether or not they develop symptoms or if they actually had it. So we're hoping that this test will provide our valued donors insight into whether or not they may have come in contact or been exposed to the coronavirus.
So if someone's interested in donating blood in the Tennessee Valley, which includes Western Kentucky and Bowling Green, where would they go about finding out more information?
You can visit us at redcrossblood.org or call 1-800-RED-CROSS. Or you can download the Red Cross Blood Donor app and schedule an appointment. You can also use your Alexa device and schedule an appointment there as well.
It's just that simple. Tiffany Taylor, thank you so much for joining us. I'm Barbara Deeb. This is Coffee Near Me here on WKU PBS, and I am coming to you via Zoom from my living room. Tiffany joins us from Nashville, the Tennessee Valley American Red Cross office. And who would you like to sit down and have a cup of coffee and a conversation with? Let us know. Keep the conversation going in our comments section. And Tiffany, we always ask our guests at the end of our conversation, if you could, living or dead, have a cup of coffee and a conversation with someone, who would that be?
Ooh. Wow, that's a good question.
Don't think too long.
If I could have a cup of coffee and conversation with someone, it would most likely be the Reverend Dr. Martin Luther King Jr.
There you go. Cheers. Tiffany, thanks for joining us. Thanks.
Thank you.